Students, welcome back. So in this video, we are going to talk about reproductive health and why it is important. So why reproductive health is a concern? Because every year there will be a lot of female who are getting pregnancies unwantedly. Okay, unwanted pregnancies. So we need to avoid these unwanted pregnancies. And second most important thing is that family planning. It means if you want to take a gap between your two childs, suppose children one has taken birth and to give birth to child two, you need to maintain some gap so that mother health will not get affected. So keeping in concern about the mother health, they need to maintain at least 2 or 3 years between the two children. Okay, so that is called family planning. Or after giving birth to two children or three children, if you don't want to give birth to your children again, it means you need to stop producing children. So that is also called as family planning. So how you are planning your family. So how to stop the production getting unwanted pregnancies? That is again a question over here. Okay. And apart from that, the diseases. So during the course of sexual intercourse, there are some diseases, particularly the bacterial and viral infections, which are transferred from one individual to another individual, either from male to female or female to male. So to protect from these type of diseases, how we can protect from these type of diseases? The most one which you have heard from your high school is HIV AIDS. So apart from this, there are many other diseases. So how you are going to protect yourself from these diseases during the sexual intercourse? So all those aspects we are going to talk in the reproductive health. So to make it short and sweet, there are three methods, or there are three ways. One is the physical ways. It means use of some physical things, and the second one is chemical ways. So use of some chemical concepts or chemical molecules or drugs, okay, or devices, chemical devices. And third one is the surgical. So surgical methods is related to the family planning but not related to the sexually transmitted diseases. Keep in mind. So surgical methods are related to family planning but not related to sexually transmitted diseases. Okay. So coming to the physical methods, so all these things we are call it as contraception. What do we call it as? Contraception. So what is contraception? Prevention of the unwanted pregnancy is called contraception. Okay. So first thing is the use of condoms. So what are condoms? So these are the physical things which you need to wear during before the sexual intercourse. So when you wear these condoms or when you use these condoms, so it will prevent, it will stop the transmission of infections like bacterial infections like gonorrhea, syphilis, and viral infections like warts and HIV AIDS. So these diseases transmission can be stopped by using the condoms. And apart from this, it will also prevent pregnancy. It will also prevent pregnancy. How it is preventing pregnancy? By the stopping the exchange of body fluids. When you use condoms, the exchange of body fluids will not take place. Exchange of body fluids will not happen. Okay. So as the exchange of body fluids not happens, the pregnancy will not take place. Okay. So this is how the condoms are going to help. So now let us talk about the contraceptives. Contraceptives is the chemical method. It will change the hormonal balance of the body. Okay. So the hormonal balance will be changed. So what happens when the hormonal balance is changed? The eggs are not released. or the fertilization will not happen. Okay. So here, what is you are doing here? This is exclusively for females. Okay, ma'am. So when you are taking these contraceptives, so hormonal balance is going to change. It means you are making your body imbalance. So when your body is in imbalanced condition, eggs are not released and the fertilization will not occur. And there are some side effects because you are making your hormonal imbalance over there, right? So the side effects will depends on the dosage. So it is highly recommended to consult a doctor before taking the contraceptives. And there are some devices such as loop or copper T which will prevent the pregnancy. It means when the sperms enter your vagina, so this loop or copper T will release copper ions, which is going to kill the sperms. So this is how the pregnancy is prevented. So these methods are not recommended as they have side effects. So that is the reason I was suggesting that to look at the doctor immediately. Okay, before taking any of these tablets. Okay, so now let us talk about the surgical methods. So surgical methods, we can do it in males as well as females. So if the vas deferens is blocked, that is called as vasectomy. So you know from the testis there will be tube-like structure come opening to the urethra, right? So this vas deferens is going to be blocked. The second one is the tubectomy. So in the female reproductive system, we have a fallopian tube, right? So this fallopian tube is going to be blocked. So this is called tubectomy. So that egg cannot reach the uterus. So there will be no implantation, there will be no fertilization. So these methods are safe in the long run. So questions. So list 3 techniques that has been developed to prevent pregnancy. What is contraception? This is the most important concept. Definitely you can expect question in your CBSE exams. So you can see here, like because of this, the third question, the teacher explained in the class that reproduction is the process by which organisms increase their population. Manoj wanted to know more about reproductive health. Therefore, the teacher also explained in the class about the diseases that can be transmitted. So many of the students during the course of this chapter, they will be very shy to listen or they are really shy to ask the doubts. But it is always appropriate to reach in person to your teacher. So to ask clear your doubts. So why, like here Manoj is asking doubts, but is it good to ask the doubts? Yes, if you are too shy, you can go in person and ask the doubts because the reproductive health is very, very important for a human being. Okay. So if a person has unsafe sex, it means sex without using condoms, then he may get in trap of the sexually transmitted diseases or the females may get unwanted pregnancies. To avoid such complications, okay, you need to understand the things much better. So why the teacher has to tell all these things? Because it is their duty to explain all these things to the student at an early age. So we all know that prevention is better than cure. So to prevent the things, the teacher is explaining to you all these things. So it is the best things to clear your doubts. So state in sequence of steps of sexual reproduction and right to advantages. 4 points of reproductive health in a society. Name 2 reproductive health which have improved over past 50 years. So all these things try to answer on your own. So we'll be updating the answers video separately. Thank you for watching.